Hi, today we are going to see how classification of retinopathy of prematurity evolved over the years. In 1984, the first international committee classified ROP based on location, extent, and stages. They also defined plus disease. The retina was divided into three zones with optic disc as the center, because the retinal vasculature arises from the disc and proceeds towards the aura. Zone 1 is the posteriormost part, and the radius of zone 1 is twice the distance between the disc and the center of the macula. Zone 2 is outside zone 1 and extends up to the nasal ora serrata at the horizontal meridian. Zone 3 is the remaining crescent anterior to zone 2. Extent is specified as clock hours involved. Moving on to stages. Stage 1 is the demarcation line, which is a distinct demarcation between the avascularized retina and the vascularized posterior retina. Stage 1 lies within the plane of the retina. Stage 2 is a ridge where it develops height and width and it is out of plane of the retina. Stage 3 is when there is extraretinal fibrovascular proliferation, and stage 4 is retinal detachment. Later in 1987, they classified retinal detachment into partial and total. In 2005, they introduced the terms pre-plus disease and aggressive posterior ROP. So plus is basically arteriolar tortuosity and venous dilatation in at least two quadrants. Anything that is not sufficient enough to reach plus is defined as pre-plus disease. Aggressive posterior ROP is a more severe form and posteriorly located, often occurs with plus disease. It progresses rapidly to stage 5. I will talk about ICROP3 in next part.